What I really am is a small business person. I own a small business, and I run a small business, a business with 15 employees, with less than $5 million in revenue. It is the characteristic small business perception in the United States. When I got the opportunity to come to ASBA, a reporter stuck a microphone in my face and said, "So, Ms. Koerber-Walker, how are you going to solve the healthcare problem?" And I was trying to think of a really good response other than just pure deer in the headlights. And so I looked at him and I said, "Well, you see, if it was my job to solve the healthcare problem, they would have made me CEO of the country, not CEO of the Small Business Association." And then I went back to my office, patting myself on the back, saying, "Oh, wasn't I glib and smart?" And then I started talking to our members, and I found out that it was a real problem. And then I started talking to other businesses, and I found out that people were starting to give up on a real problem. Well, the cool thing about small business is small business never gives up. So what we're going to be talking about today is a healthcare solution for small business. We're going to talk about what the challenge is and why, whether you have health insurance or not, it affects all of us. And then we're going to look at one team solution to move progress forward. It's not the only solution. It may not be the best solution, and there's probably no perfect solution. But it's progress in a world where there hasn't been progress for a while. One of the things that I always hear from people is, "Well, I'm not a small business because I have 100 employees. I'm not a small business. We have offices in 3 states. I'm not a small business. We're making good money." Of those small businesses, 110,000 of them have employees. Small business represents over 1 million Arizona workers. Small business is big business in Arizona. When you talk to small businesses, whether you're talking to them in Arizona, whether you're talking to them in Oklahoma, whether you're talking to them in Washington, D.C., the number one issue for small business is healthcare. How do I get it? How do I control the costs? How do I keep it so that my employees and their families are healthy and safe? And how can I afford it without putting my business at risk? That's the number one issue. So when we start talking about the top issues that affect small business people, people like me and people like you, it's all touched by healthcare. Well, access to capital is based on the productivity of your business. Banks don't loan money to losers. Can you be productive if your people aren't healthy? Navigating the bureaucracy. Well, let's see. If we could solve that problem, I think then I'd be CEO of the world. The tax gap, that ever-widening gap between small business and big business. And then finally, immigration and the impacts that that has not only on our business system, but on our healthcare system. When we talk about our nation's healthcare emergency, we have some of the best healthcare in the world. We spend more per capita on healthcare than any nation in the world. We have more advancements in healthcare than any nation in the world. But as you're going to see in a few minutes, if we don't start changing some things, we won't be able to afford our own healthcare. So here's something to think about. In 2006, healthcare spending in the United States was 16% of our gross domestic product. Think about it. 16%, 16 cents of every dollar that was created in the United States was spent on healthcare. And by the time we get to 2015, 2015 will be well over 20%. Now the question is that the right thing to be spending on? And are we spending smart? Because as small business people, we have to know how to squeeze a nickel. We'll talk about that a little bit later. And the uninsured, 1.2 million. It's estimated, and these are federal figures provided by the Kaiser Commission on Medicaid and the Uninsured, is that 60% of that 1.2 million people own or are employed by small business. Pretty interesting. They're more productive because if they're getting regular health care, they're not missing work time. And if they're not missing work time, the company's not experiencing downtime. Healthcare is good business. You don't have to be a bleeding heart to see that this is important.